going back to that historic moment at the Philippine General Hospital where the COVID-19 vaccination kicked off this morning. The government hospital's director, Dr. Gap Legaspi, was the first to receive a dose. Head nurse Chareluck Santos administered the shot to Legaspi. We go above and beyond the headlines with Nurse Santos herself. She joins us now on Newsnight. Thank you so much for joining us, Nurse Chareluck. Ninervyos ka ba? Ninervyos ka ba that you were basically the first nurse in the Philippines to vaccinate si PGH Director Dr. Gap Legaspi?
Yes. I was really excited po. And ayun nga, it's true, meron pong halong kaba. Especially, hindi naman kami sanay at PGH to have such a media coverage po.
Talagang you are now part of history, Nurse Chareluck. Pero, Nurse Chareluck, kasi you were the first one to administer yung Sinovac vaccine dito sa Pilipinas. Pero nagkaroon ng mga questions no sa social media. May nagtatanong, bakit hindi kayo naka-gloves?
Actually nga po, narinig ko yan. And a lot of people are asking us about this. After the vaccination. And even during the vaccination, they were asking us. But we have to let people know po that during our DOH orientation, they oriented us not to use gloves anymore during this vaccination drive. Ang dahilan nga daw po nila is it would be safer for us to do hand hygiene frequently. Kasi po pag ikaw ay gloves, hindi ka na masyadong mag-hand hygiene minsan, baka makalimutan mo, and yung nga, i-dispose mo siya ulit, and it's much easier po kapag ikaw ay nag-hand hygiene in between patients po. And that is the training po coming from DOH 10. So yun ang protocol po nila.
So, Nurse Chareluck, ilan ang tinurok ninyong Sinovac vaccine today?
Today po, we had a total of 128 vaccines po.
Pero you personally, ilan ang pinaturok ninyo?
Ako po. Ako personally po, ako ata ay naka 5 or 7 po na vaccines.
Pero tuloy-tuloy yan.
Sunod na po sila after. Yes, tuloy-tuloy naman po.
Okay. So, pero I mean, apart from vaccinating the first person in the country, you also have a personal milestone, no? Nagpaturok rin kayo. You also had yourself vaccinated. Any side effect pagkatapos ng bakuna? Because we saw there were some side effects for patients in several hospitals in Metro Manila.
Okay po, in PGH po, like the training naman in DOH, we have a system of monitoring post-effects po ng after vaccination natin. So, as of now po, wala pa naman tayong official na nare-report na effects po after the vaccination. Ako naman po, personally, after na mabakunahan, sa ngayon po, kailangan pa rin naman natin ng observation. But as of now, wala naman po akong ibang nararamdaman kahit po yung pagbigat ng braso ay wala.
Well, that's good news. Pero ano bang sinabi sa iyo, Nurse Chareluck, kailan yung second dose? Will it be after 14 days or 28 days?
Sa amin po sa PGH, after 28 days.
So, what made you decide, Nurse Chareluck, to have yourself vaccinated with a vaccine that only has 50% efficacy? Kasi yung mga ibang mga nurses, kagaya nyo, ayaw magpabakuna kasi natatakot sila na 50% lang efficacy and they will wait until dumating yung mga Western vaccines na yung efficacy is between 90 to 95%.
Ako naman po personally, I always respect the decision of mga fellow Filipinos or kahit po yung mga kasamahan kong health workers. I always respect their decision. And I believe naman po that they do their own research and they try to understand kung ano ba po yung bakuna na para sa kanila ay nararapat na mabakuna. Ako po, I decided na magpabakuna na since I believe po kasi na the best vaccine is yung kung ano yung available natin ngayon. So yung mga susunod na bakuna po kasi natin ay wala pa rin naman talagang linaw po, and naaral ko naman po, nabasa ko naman ang safety naman po ng bakuna nito. That's why I decided to add a layer of protection to myself, not just only physical distancing, the mask and the face shield. Additional protection po is through this vaccination po.
So Nurse Chareluck, are you confident that more of your colleagues, mas maraming mga kababayan natin ang magpapabakuna bukas pagkatapos itong historic first day of having our vaccination program?
I hope so naman po. I hope so.
And for those from the hospital who are still hesitant to have themselves vaccinated at saka nasa listahan to be vaccinated, ano ba mangyayari sa kanila? Your colleagues at Philippine General Hospital, maghihintay na naman ba sila? Do they have to wait in line again pagkatapos yung mga nasa listahan na nagpapabakuna mabukas?
Okay, during our town hall meeting po, it was discussed that the healthcare workers will have the first right of refusal, which means na kahit hindi po nila tanggapin ang bakuna na inaalok sa atin ngayon ng government, ay hindi po sila mawawala sa pila. Sila pa rin po ang magiging priority once na magkaroon na po ulit ng delivery ng ibang bakuna po for COVID.
And would you encourage our kababayans to have themselves immunized, magpabakuna dito sa Chinese vaccine na ito?
Tulad po sa mga napag-aralan po at nabasa ko po, during the pandemic ng mga nakalipas na panahon, hindi lang naman po ito ang unang pandemic na naranasan natin sa buong mundo. Meron din pong mga pandemic dati. Ang isang malaking tulong po para matigil ang mga pandemic noong unang panahon po, nakatulong ng malaki yung vaccination po. So I think tayo po ay natututo sa mga naranasan natin noong mga dating panahon. Kaya naniniwala rin po ako na ang pagpapabakuna natin ay isang step po so we could help end this pandemic po.
Thank you so much for joining us on Newsnight. Chareluck Santos, Head Nurse at UP Health Services at the Philippine General Hospital.